Hello, I'm Urologist Erdem Akkaya. Today, I will have a short video presentation about what is HCG, meaning, human chorionic gonadotropin, what it is used for. Human chorionic gonadotropin is the hormone that ensures the survival of the baby secreted from the place where the baby is attached in the mother's womb, that is, the placenta region during pregnancy. It is not patented and it is natural. It has been used in medicine for about 80 years. It was discovered in 1920, separated from the urine of pregnant women in the 1940s and is still used. It is mostly used in female infertility and menstrual irregularity. It was once marketed as a weight loss drug, and once as a penis enlarger. It has been widely used in men in the last 20 to 30 years. Especially after anabolic steroid use, in PCT or in testosterone replacement treatment in cases of infertility due to hypogonadism and erectile dysfunction due to hypogonadism to enlarge the penis and testicles before puberty, and it can be used in cases of micropenis. I got to know HCG about 18 years ago in a baby who came to us with undescended testicles. I was an assistant at that time. When I saw the baby 1 month later when we used it, I saw that the penis had doubled in size. The testicles went down and the penis size had doubled. HCG has two subunits, one beta and one alpha. Since the beta subunit increases exponentially during pregnancy, we use it in pregnancy tests. In the pregnancy test, the level of beta HCG in the blood is checked. When we look at the alpha subunit, we see that it resembles the LH, FSH and TSH form, but the alpha subunit creates the LH effect. How is HCG different from normal LH? Normally, the half-life of LH in the blood is 20 minutes, whereas the half-life of HCG reaches 20 hours. In other words, HCG provides a strong and prolonged LH effect in the blood. It stimulates testicles in men and eggs in women in a powerful way. Anabolic users usually use HCG at frequent intervals after or during the cycle in small doses to protect against testicular atrophy or to activate the testicles. In testosterone replacement therapy, we make dose adjustments in HCG. We look at estrogen and testosterone levels 1 month after starting HCG. And we balance estrogen levels with aromatase inhibitors. Because there is a risk of gynecomastia due to increased estrogen, it is necessary to pay attention to it. Also, very dramatic result is obtained in cases of infertility due to hypogonadism and micropenis in adolescents due to hypogonadism. We have the chance to use HCG in cases of micropenis until the age of about 20 to 24. It is a bit of trouble for those cases to come to the doctor because the patient is shy and afraid to come. But we can achieve a serious growth of the penis with a 2 to 3 month treatment, so if the patient has hypogonadism. Other than that, what kind of side effects does HCG have? The side effects of HCG are actually the classic side effects due to testosterone or estrogen increase. The one we fear most is, as I mentioned before, gynecomastia. We can adjust its doses a month later before it develops. How is the usage of HCG? The method of use of HCG can be subcutaneous, i.e., it can be applied under the skin or directly into the muscle. What's the difference? You can inject high doses directly into the muscles. You need to do it under the skin in lower doses at frequent intervals. Also, when you do it under the skin, the half-life becomes longer than the muscle. Because HCG is dispersed faster in the muscle. Other than that, there is no serious difference between them. One of the disadvantages of HCG is that there may be a decrease in the response of the Sertoli cells in the testicles in who use HCG for a long time. In other words, testicular atrophy can occur in those who use HCG for a long time. It may be necessary to change here. It may be necessary not to use HCG all the time in post-cycle treatment, or in patients it may be necessary to evaluate other options of testosterone replacement therapy. Other than that, HCG does not have any serious side effects, It is a substance that has been used for 80 years and is a natural substance. Thank you for listening, best regards.